Well, it's been more than 5 years now since the pandemic upended our lives, and we were, of course, introduced to COVID-19. Tonight, we're taking a closer look at the COVID-19 vaccine.
So we're hearing from so many of you who still have questions like who should get the vaccine? Is it safe? And is it readily available in our community right now?
And helping us to clear up some of the confusion this evening is Dr. Olukemi Akinrinola, a pediatrician with Advent Health. Dr. A, thank you so much for joining us tonight.
Welcome back, Dr. A.
Thank you. Thank you for having me.
Well, let's start with a really basic question here, which is who should be getting the COVID vaccine at this point?
I would say everybody should still be getting the COVID vaccine just because we know that anybody can have a risk of having the severe illness. But at least we know very particularly people who are older, 65 years and older. We saw that the COVID deaths and hospitalizations are more in that population. Then anybody that hasn't gotten the COVID-19 vaccine before should be getting it. Anybody that's pregnant or breastfeeding or planning to get pregnant, we expect them to get the vaccine. Also people with chronic ailments and people who we know can have the severe risk of, the severe COVID illnesses. And that is that's a broad spectrum because we're talking about people with cancers, people with autoimmune conditions, chronic lung diseases, chronic heart conditions, people who have dementia, people who are in the long-term facility, and the list goes on. And so you almost see it at anybody should be able to get the COVID-19, and we would recommend that they do get it.
There's been some concern about the supply of vaccines this year. What has your office been hearing? Are people calling, asking if it's available and who can access it?
It's a very peculiar time, honestly, and it is not the way we would have wanted it because we're seeing the COVID-19 infections. I mean, we have a new strain that is coming out and it's not showing the typical symptoms that people are used to, the upper respiratory. Sometimes it's showing the GI symptoms and all. And so usually we want to be prepared. And so we're getting the calls that they want the COVID-19 vaccines, but the ones that we have has not been approved and the ones that has been approved is not readily available. And so what we're doing is we're telling them to just stay tuned and keep calling. Things are changing, just like we just heard that the Board of Pharmacy just approved, so that we don't need to, as providers, send a prescription to the pharmacies. Now they can order it so that we can have wider, availability. So we don't have it. The people are calling all the time, especially because they're seeing infection occurring.
You said really you recommend everyone should be getting the shot. What about kids? Should they be getting the shot as well?
Yes, they should be getting the shots as well. And just I see kids, right? So I'm already seeing them with infection. And we know that the COVID-19 vaccine is the way to protect you from the severe illnesses that can make people be hospitalized and deaths and even have the long COVID symptoms and all. And so we know that that's a reliable way. So we recommend, especially for the young kids, 6 months and above. If you're in a daycare setting, if you're staying with big families, and essentially anybody, because sometimes you look at the risk factors, these people for sure, but anybody can actually have the severe COVID illnesses. So we would recommend every kid from 6 months and above to get the vaccine.
Thank you so much, Dr. A, for clearing this up, especially as we're heading into flu season. All of this information is great to know. We appreciate
your time. Thank you.
You're welcome. Thank you for having me.